much do you truly understand about depression and bipolar disorder? Depression and bipolar disorder. These are not just words or mere medical terms. They are profound mental health conditions that impact the lives of millions around the globe. Each day, they navigate through the world, grappling with feelings and emotions that are often misunderstood. Depression is a mood disorder that causes persistent feelings of sadness and loss of interest. It's more than just feeling low or having a bad day. It's a serious condition that affects both physical and mental health. On the other hand, bipolar disorder, also known as manic depressive illness, is a brain disorder that causes unusual shifts in mood, energy, activity levels, and the ability to carry out day-to-day tasks. These conditions are not a sign of weakness or something that one can simply snap out of. They are real, tangible, and often debilitating. 1 in every 4 people will experience a mental health issue at some point in their lives, and depression and bipolar disorder constitute a substantial portion of this. They can strike anyone at any time, regardless of age, gender, or socioeconomic status. They do not discriminate and they do not pardon. Yet despite their prevalence, there is a significant lack of awareness and understanding about these conditions. Stigmas and misconceptions still persist, often preventing people from seeking the help they need. It is crucial to dispel these myths and to bring light to the reality of these disorders. Understanding depression and bipolar disorder is not just about knowing the definitions or recognizing the symptoms. It's about empathy. It's about understanding that behind these labels are individuals. Individuals who laugh, cry, love, dream, and feel just like anyone else. So let's embark on this journey together. Let's strive to understand these conditions, not just for our sake, but for the sake of those around us. Let's learn to recognize the signs, to offer support, and to fight against the stigma. Because mental health matters. As we delve deeper, remember, knowledge is the first step to understanding and empathy. Behind the smiles and laughter, what are the signs of someone struggling with depression or bipolar disorder? We often think of depression as a state of persistent sadness, but it's more than that. It's a complex condition that can present a variety of emotional symptoms, such as feelings of hopelessness, guilt, and worthlessness. Those with depression may lose interest in activities they once enjoyed, and struggle with thoughts of death or suicide. Bipolar disorder, on the other hand, is characterized by extreme mood swings, from manic highs to depressive lows. During a manic episode, an individual might feel euphoric, invincible, or unusually irritable. They may engage in risky behaviors or have racing thoughts and rapid speech. In a depressive episode, they experience the same symptoms of depression we've just discussed. But the signs of these conditions aren't just emotional, they're physical too. Depression can cause changes in appetite or weight, sleep disturbances, and a decrease in energy or motivation. Bipolar disorder can lead to similar physical symptoms, particularly during depressive episodes. And then there are the behavioral signs. Someone with depression may withdraw from friends and family, neglect responsibilities, or struggle with concentration. In the case of bipolar disorder, during a manic phase, the person might take on multiple projects at once, make grandiose plans, or become easily distracted. It's important to remember that these symptoms can often be difficult to recognize. They may emerge gradually, and they can be easily mistaken for a rough patch or typical teenage angst. And let's not forget that these conditions don't just affect the individual. They impact relationships, work or school performance, and overall quality of life. The key takeaway here is that depression and bipolar disorder aren't just about feeling sad or overly happy. They're serious conditions that affect all aspects of an individual's life. Recognizing these symptoms is crucial, but understanding their impact creates a clearer picture. Depression and bipolar disorder are not just feeling sad or being moody. What are the real dangers, you may ask? Well, let me tell you, the dangers of these conditions are grave and far-reaching. They extend beyond the emotional realm into the physical, social, and even existential aspects of our lives. Untreated depression and bipolar disorder carry a significant risk of suicide. Yes, it's a heavy topic, but it's one we cannot afford to ignore. The intense feelings of hopelessness and despair that accompany these conditions can sometimes lead individuals to believe that ending their life is the only way out. In fact, suicide is one of the leading causes of death among people with these conditions, but the dangers do not stop there. Let's talk about relationships, for instance. These mental health conditions can cause severe strain on personal relationships. The unpredictable mood swings of bipolar disorder and the persistent sadness of depression can leave loved ones feeling helpless, frustrated, and emotionally drained. This often results in the affected individual feeling isolated and misunderstood, further deepening their despair. Then there's the impact on physical health. Yes, mental health issues can indeed affect your physical well-being. The chronic stress of dealing with depression or bipolar disorder can lead to a range of physical health problems, from heart disease to weakened immune systems. Moreover, these conditions can impede one's ability to function at work or school, leading to poor performance, job loss, or dropping out of school. The financial strain and loss of self-esteem that ensues can further exacerbate the condition. In a nutshell, untreated depression and bipolar disorder can lead to a downward spiral of worsening mental and physical health, strained relationships, and even life-threatening situations. But it's not all doom and gloom. The key word here is untreated. These conditions can be managed, and individuals dealing with them can lead fulfilling lives. The stakes are high, but hope is not lost. Effective treatments exist. What hope lies in the face of depression and bipolar disorder? What treatments are available? Depression and bipolar disorder, like many other mental health conditions, are treatable. The first step towards recovery is understanding that these conditions require professional intervention and treatment. It's essential to remember that treatment is often a long-term process, but it is the key to managing these conditions and living a healthy, fulfilling life. Medication is one of the most common forms of treatment. Antidepressants, mood stabilizers, and antipsychotics can help balance the brain's chemicals and stabilize mood swings. But remember, medication isn't a one-size-fits-all solution. It takes time to find the right medication and dosage that works best for each individual. Psychotherapy, also known as talk therapy, is another effective treatment. It provides a safe space for individuals to discuss their feelings, thoughts, and behaviors with a trained professional. Cognitive behavioral therapy, or CBT, is a popular form of psychotherapy that teaches individuals how to identify and manage harmful thought patterns. Lifestyle changes can also play a significant role in managing depression and bipolar disorder. Regular physical activity, a balanced diet, adequate sleep, and reducing stress can all contribute to overall mental well-being. These changes are not substitutes for medication or psychotherapy, but they can complement these treatments and help individuals feel better. In some cases, more intensive treatments may be required. For instance, electroconvulsive therapy, or ECT, involves passing small electric currents through the brain to trigger a brief seizure. ECT can often quickly reverse symptoms of severe depression or mania when other treatments are ineffective. It's important to remember that each person's journey with mental health is unique. What works for one person might not work for another. Patience, persistence, and open communication with healthcare providers are crucial in finding the right treatment plan. Remember, mental health conditions are not a sign of weakness or a character flaw. They are medical conditions that require care and treatment, just like any other health issue. Treatment is a journey, not a destination. But there's another piece to this puzzle: self-help and support from loved ones. How can you help yourself or a loved one battling depression or bipolar disorder? The question is one that echoes in the minds of many. The answer isn't always clear-cut, but there are ways to navigate these turbulent waters. Firstly, self-help strategies can be instrumental in managing depression and bipolar disorder. One of the most important aspects of self-help is self-awareness. By understanding the patterns of your moods, you can predict and manage potential episodes. You can do this by maintaining a mood diary, tracking your feelings, and noting what triggers changes in your emotional state. Physical health is another crucial element. Regular exercise, a balanced diet, and adequate sleep can all contribute to better mental health. Additionally, mindfulness practices such as yoga and meditation can help manage stress and reduce symptoms. For those supporting a loved one, understanding is key. Depression and bipolar disorder are not choices, they are conditions. It's essential to acknowledge the reality of these disorders and to be patient. Remember, your loved one may not always have control over their emotions or behaviors. Active listening is another powerful tool. Instead of trying to fix the problem, just be there. Listen without judgment. Encourage them to share their feelings and thoughts. This can help them feel less alone in their struggle. Encourage your loved one to seek professional help if they haven't already. Mental health professionals can provide valuable guidance and treatment options. Support them in following their treatment plan, and be there for them during the ups and downs of their journey. Finally, take care of yourself too. Supporting someone with depression or bipolar disorder can be emotionally taxing. It's important to practice self-care, seek support when you need it, and maintain your own mental health. Depression and bipolar disorder may be battles, but together, we can be an army of support. Remember, recovery is not a straight path, and progress may be slow, but every step forward counts. Together, we can make a difference and bring light to the darkness of these conditions.